Thank you, Katie. Okay, now I'm in the slightly awkward position of having to introduce myself. Hi, I would like to introduce me. I am a professor at the University of Canberra. I'm the director of the Centre for Environmental Governance there, and I also lead the WellRes Unit. My work focuses very much on understanding how we build opportunity for good wellbeing for different Australians, and I have a particular focus on how we support those who experience change in natural resource management, which we'll hear a bit about tomorrow. Together with me, we'll be hearing from Dr Mel Mylek. Mel is a research fellow in the Health Research Institute in the WellRes Group, and she focuses also on understanding the health and wellbeing of different groups of Australians, and particularly wellbeing measurement and indicator production. She leads the annual Carer Wellbeing Survey and has recently partnered with Carers Australia and the Australian Government Department of Social Services with funding from the ARC to continue that survey for a further 3 years. Yay, I'm on the right one. Excellent. All right. So what we're going to do is talk today a little bit about what does it mean to look at the wellbeing of different Australians. Kate began talking about this, we'll continue it. And we'll start with that big view that we tend to hear on the news, which is that Australians have great wellbeing. How many people have heard this sort of, a news media thing saying Australia ranked somewhere in the top 10 internationally on some wellbeing index? Hands up? Yeah. I've just got one example here. It's the OECD's Better Life Index. We're right near the top. Higher is better. The yellow bar is Australia. You don't need to try and read all of that. You could also look at the World Happiness Report from 2024, where we ranked 10th out of 143 countries in their measures of happiness, and different places use different measures of wellbeing. So we also have lots of others that I won't go into. The challenge when we hear this story that Australians have great wellbeing is that we need to make sure we go below that sort of big picture into detail. And when we go below the headline, we often lack detail. If we actually look in Australia, it's easy to say, well, we must be doing fine. We must know lots because of these big headlines, but actually that's not the case. Our major national data collections at the moment were not designed to capture many of the things now known to be critical to wellbeing, like measures of social connection and loneliness, inclusion and exclusion, lots of others. And many of the things we do measure in some of those surveys are not measured well for all Australians, particularly some of the groups shown on the screen there. Often the samples of those groups are too small in a lot of our surveys to be able to say a lot about them. Now, lots of people are working to fill those gaps, and we're hearing from a lot of them at this conference. So there's a huge amount of work exploding onto the scene. And, we can talk about the AIHW's Australia's Welfare Report. We can talk about reports on older Australians. MyKawai, the national study of Aboriginal and Torres Strait Islander wellbeing, led by Ray Lovett at the Australian National University. The Australian Unity Wellbeing Index, we may have just heard about that. The SGS Cities and Regions Wellbeing Index, and I can keep going. At UC, we run the Regional Wellbeing Survey, the Carer Wellbeing Survey, and the Living Well in the ACT Region Survey, all designed to do some of these things. And I can keep going. And we're really looking forward to seeing what comes out of measuring what matters and what gets included in the General Social Survey as the ABS is able to expand that to include more measures of wellbeing for more Australians. What I want to do today is talk about some of the insights from our own regional wellbeing survey. We started back in 2013, and we started because there was a lack of data for any regions outside Australia's cities. So if you go to most of our major surveys, you will be able to see results, and they will talk about typically, if you're lucky, here's what it looks like in this major city, and here's what it looks like in the rest of the state. Now, oddly enough, rural communities and people living in them get a bit cranky when they're all lumped into one group. Can't imagine why. They're not at all diverse, of course. So we started the Regional Wellbeing Survey to fill that gap. We've been running annually since 2013. We survey 15,000 people each year, and we do not have a representative sample. We have a deliberately stratified sample that massively oversamples people living outside our major cities. It also oversamples farmers and a few other key groups, such as people impacted by disaster, so that we can say something about their wellbeing. So what I'm going to do is give a few snippets and then Mel will talk about the Carer Wellbeing Survey. And I guess what we want to encourage is that digging below the surface. We're at the stage now where we can easily produce this sort of data, and this is showing the wellbeing. So in this case, I'm also using the Personal Wellbeing Index, but we've measured our data online, and there's fun survey mode effects. Statistics nerds, hands up. Yeah, come and talk to me at lunch about survey mode effects. I can go on for a long time. What I'm presenting today is the proportion of people who have healthy levels of wellbeing using the Personal Wellbeing Index rather than the mean score. Now, we can define what is a healthy level of wellbeing in many ways. Not everyone will agree with where we've put the threshold, but it gives us a comparison we can use over time. And this graph looks pretty boring, whether you're living in inner regional or outer regional or remote areas. Remote is all the yellow in the middle of Australia. Inner regional is a darker green and outer regional is medium green. We see a few differences in that proportion of people with healthy levels of wellbeing when we just look at those averages across all of regional Australia. But when we look at the same data and we break it down by regions within New South Wales, this is actually showing change in the proportion of people who have healthy levels of wellbeing by New South Wales region between 2018 and 2022. Red is where we saw the proportion of people with healthy wellbeing decline by more than 5%, and that means that we're confident it's a real decline and not a statistical artefact. So that's why we've picked that threshold. It works for our data. Green is where it's increased by more than 5%, and yellow is where there's not been a meaningful change in the proportion of people with healthy levels of wellbeing in that period. Now, if I chose a different 2 years to compare over time, I would get a different sea of red and green. It does fluctuate a bit. And this is drawn from a dashboard that we'll be talking more about tomorrow. I can also look at then what's going on behind that. And this is showing the proportion of people who agree that they would recommend their community to other people as a good place to live. Why am I showing this? Because measures of livability, particularly in regional communities, do have a reasonable, not massively strong, but a reasonable correlation to wellbeing. And they do so more strongly in a lot of our rural communities than our urban areas because there's potentially, we theorise, less choice for people in a lot of regional communities about where they can go to improve amenity and livability or get some of those benefits. You've got more limited choices, so you want to enjoy living in the community in which you're in. And you can see there that we're again showing change between 2018 and 2022. We are seeing a lot of change in regional Australia, and one of the things I would like to show again talks to the COVID story. We had similar results to Kate in our COVID data in 2020. Wellbeing in regional Australia went up, and we saw the exact same patterns, and so many surveys have found it, and it really highlights exactly what Kate was talking about. But this is showing a different measure. We ask people how regularly they participate in community activities and events, because we know that's an important aspect of social connection in many communities. Back in 2013, 59% of regional Australians in the orange bars reported regularly participating in local community activities. Went up a little bit the next few years. From 2018, it declined. We often blame COVID for a decline in community participation. Our data suggests it started well before COVID in a lot of our communities. And that it's, while we saw a big dip in COVID, community participation is not recovering so far. We're looking forward to measuring again this year to see if we are finally getting that bounce back. And that's a real concern about wellbeing and something we need to track. Now, with the sort of data set we are looking at, as I mentioned before, we're tracking the wellbeing of people impacted by droughts, fire, flood and storm. And what we're finding there is a few different stories. If you only have been impacted by one of those things materially, meaning you experienced personal damage or you were under your life or home were under direct threat, if you only experienced that once, your wellbeing's pretty similar to every other Australian. We're actually pretty good at dealing with one event, unless it was quite severe damage. If you've experienced moderate to severe impacts from 2 to 3 to 4 events, that's when we see wellbeing decline. This is again showing the proportion with healthy levels of wellbeing. So if we head to the end there, if you've had severe impacts from multiple disasters, and concerningly, we have a small but significant proportion of rural Australians who have experienced this in the last 5 years, the proportion with healthy wellbeing declines significantly. It's much smaller. We can also look at wellbeing of farmers. Now, we hear a lot of concern about the wellbeing of farmers in the media. There is a strong perception that farmers have very low wellbeing. What I'm showing on this slide is the proportion of farmers with unhealthy levels of wellbeing. It's not actually worse than the average adult Australian. It is, in fact, better. So farmers, on average, have higher levels of wellbeing than the average Australian. Now, that's partly because they're older. Remember how Kate talked about the U-shape? Your average farmer is aged 55. They're well and truly on the upswing of the U if things are going well for them. But even after controlling for that, farmers do on average have higher wellbeing. There's a range of reasons for that. And interestingly, we've seen this similar dichotomy for some other groups. There are other population cohorts that have similar issues. Farmers do have a higher than average risk of suicide, for example, but have conversely high wellbeing. These are the things we need to understand better. And what we do know about farmers is that their wellbeing can change really rapidly. And we know that unlike a lot of other groups, it's very strongly influenced by what's happening on the farm. Now, any worker their wellbeing will be influenced by what's happening at their work. But for farmers, that's amped up. It's much stronger in terms of the influence on their personal wellbeing scores. When we ask them questions in our survey about how are your farm business conditions going? How's your welfare of your livestock going? How much financial stress is the farm under? What have you been exposed to lately in terms of work stress? That correlation is very strong. And we're also starting to see things like work that looks at nature positive. So Ken Henry spoke about the need to change how we work in our economy. In the farming sector, regenerative agriculture is being promoted as a nature positive approach to agriculture that is building the condition of the environment and the land farmers manage. And we've been doing work looking at whether adopting that regenerative farming improves the wellbeing of farmers. And the short answer is that we are finding that it does. It's small, but it's measurable. So sometimes improving wellbeing and improving environmental health, we can actually see those going hand in hand. But we have to be cautious. There are some limits. Okay. Now, I could go through lots more examples. The picture at the end of 2023, this is showing the proportion of people with healthy wellbeing in a range of the groups that we're able to report on from our survey. Different age groups, women, farmers. But what I want to draw your attention to is the bottom left-hand corner. The proportion of unpaid carers who have healthy wellbeing is really low in Australia. And for that reason, we have a National Carer Wellbeing Survey to look at the specific issues that unpaid carers face, and Mel will talk about that now.
Thanks, Jackie. So, yeah, as Jackie just mentioned, this one group of Australians that consistently report some of the poorest outcomes for quality of life in Australia are our unpaid carers. So given that in 2018, there was estimated to be 2.7 million carers that were providing services valued at nearly $80 billion, it is important to understand the unique circumstances that result in these poorer outcomes and invest in strategies to help support carers to have a good quality of life so that they can continue to provide high quality care into the future. So in partnership with Carers Australia and Department of Social Services, we have been measuring carer wellbeing through the Australia-wide annual Carer Wellbeing Survey since 2021. The survey was established to better understand the changing needs of carers, their wellbeing and their quality of life so that organisations like Carers Australia and DSS know how best to support them moving forward. And if you'd like to know any more about the survey or access any of our past reports, you can go to the Carers Australia website we've got there. So what do we know about carers' wellbeing and their ill-being? Well, we do know that they're significantly more likely than other Australians to report low wellbeing. You can see here in this graph, we also measure personal wellbeing index, and thanks, Kate, for describing that so beautifully before. So in the purple, we've got the carers from Carer Wellbeing Survey in 2023, compared to, in grey, adult Australians from the Regional Wellbeing Survey. And you can see there that almost double the amount of carers are reporting low wellbeing compared to the average Australian adult, and less than half are reporting high wellbeing. And again, we've got possibly different cutoffs than other people, but low wellbeing is a score of less than 60 on personal wellbeing index, so it's quite low. In addition to that, 50% of carers in 2023 reported that their ability to maintain their quality of life is getting worse. Carers also consistently report higher than average rates of psychological distress, so that's their ill-being. In 2023, 31% of carers reported high distress rates, compared to nearly 23% of adult Australians. So carers often experience challenges with key determinants of wellbeing, particularly financial and social determinants. They're significantly more likely to experience financial stress compared to other Australians, and the graph on top there, you can see a larger proportion of carers are reporting that they're very poor or poor compared to Australians, adult Australians, and a lot more of them are also reporting that they've experienced one or more significant financial event in the previous 12 months. And they're things like needing to ask family and friends for financial support, not being able to heat or cool their home, skipping meals, that sort of thing. This can in part be explained by the nearly 2/3 of all carers who report low satisfaction with their ability to engage in paid work. And of those who indicated that they did less paid work than they would have liked to, 71% said that this is because of their caring responsibilities. Carers are also twice as likely to report being lonely. So the bottom graph there, you can see that almost double, or pretty much double the carers, 38% of carers are saying that they're often or always lonely, compared to only 19% of adult Australians. So we also know that amongst carers, there's a lot of variation in wellbeing. They don't all share the same level of wellbeing. So some carers experience poorer quality of life than others. Young carers in particular continue to face challenges in their caring role, reporting lower wellbeing, higher psychological distress, higher financial distress, and lower financial prosperity. They're also particularly susceptible to the impacts of the rising cost of living, and they're significantly less likely to have understanding workplaces or to be able to work in permanent or fixed term or flexible work environments. Other groups of carers report better outcomes, including older carers and those with lower caring commitments. So this just highlights that need for bespoke wellbeing measures that enable us to facilitate bespoke support for carers. So how can we support carers to improve quality of life as part of our future wellbeing agenda? Not all carers have low quality of life, and many carers report positive experiences with being a carer. In 2023, around 50% of carers reported that being a carer was a satisfying and/or positive experience. So one way that we can support carers into the future is to look at the factors that facilitate better wellbeing amongst carers. For example, we know that access to support and services, both informal and formal, is essential for carers to be able to provide high quality of care for the people that they care for, as well as to look after themselves. In 2023, wellbeing was higher for carers who accessed support from family and friends, who connected with other carers to share their experiences and advice, who accessed respite care, and who accessed carer training and skills courses. We also know that carers who report higher financial wellbeing are significantly more likely to report higher wellbeing. And carers engaged in the workforce are more likely to report higher financial wellbeing. Carers who report rarely feeling lonely are more likely to have higher wellbeing. In 2023, carers who reported being lonely were more than 3 times more likely to report low wellbeing compared to carers who were rarely lonely. And loneliness was even higher for carers who were not engaged in the workforce. Carers who have good access to support from family and friends are significantly more likely to report high wellbeing, and they're also more likely to be able to engage in the workforce. And carers who are employed are more likely to report higher wellbeing, and in particular, carers who have employers who are highly supportive of their caregiving role are also more likely to report higher wellbeing. So you can see a bit of a theme here. Carers engaged in the workforce are more likely to report more positive financial, social and wellbeing outcomes. So supporting carers to participate in the workforce if they wish to, and encouraging more supportive workplaces for carers is just one way that we can support carers into the future. And there is already a little bit happening in this space, including the Australian Government's Carer Inclusive Workplace initiative that was launched late last year. So monitoring its effectiveness in improving carers' quality of life will be important moving forward. Thanks, Jackie.
We are almost done. From our perspective, setting the wellbeing agenda, we need to move beyond knowing that most Australians have healthy levels of wellbeing to understanding the important stories that lie in the details. We need to measure different things for different groups. We need to make sure we're unpacking what is important to the wellbeing of those groups. And those are probably the key things we feel need to happen for the future wellbeing agenda. Thank you very much.